What is up, everybody? Welcome back to another Medical Mondays. Today we're going to talk about CBD and CBD oils. CBD is short for a longer word called cannabinoid. Now, cannabinoids are just part of a marijuana plant. In much of the literature that you read now, cannabinoids, CBDs, and THC are lumped into one entire group called cannabis. So there's two main parts to a marijuana plant. There are cannabinoids and there is THC. The THC is the part of the marijuana plant that gets all the bad rap. This is the stuff that people say is addicting. This is the stuff that people say gets you high. This is the stuff that has that euphoric feeling. CBD really has none of those euphoric feeling effects. However, it does have many medicinal benefits. CBD actually works on the body in a couple different ways. Number one, our body all has CBD receptors, cannabinoid receptors, because our body naturally produces cannabinoid, actually. So cannabinoid receptors 1 and 2 are acted upon from CBD oils or CBD powders. It also acts by stimulating certain pain receptors in the body. Now, just because it stimulates a pain receptor doesn't mean it causes pain. There are multiple pain receptors in our body that actually lower pain and lower inflammation, and that's how CBD works. Lastly, it activates directly on adenosine receptors. And what this does is it leads to a reduction in cortisol and a reduction in anxiety and other mental health disorders. It also has a great anti-inflammatory effect throughout the entire body. Now, the most common uses for CBD are sleep, for epilepsy and for cancer, for anxiety and other mental health disorders, for quitting smoking and weaning yourself off of other harder pain medications such as opioids, as well as pain relief. So number one, pain relief. Both CBD and THC, both parts of the marijuana plant, have been shown to reduce pain significantly in patients. The only problem with the studies to date is that CBD was never really separated from THC in many of the studies. Therefore, the THC would cause a lot of issues in patients who couldn't tolerate that euphoric feeling. Now that we have THC separate from CBD, there will be a lot more studies going forward with pain. CBD oils and CBD creams have shown significant benefits in pain reduction at about 2.5 milligrams to 20 milligrams a day. Usually this is a full dropper worth of CBD oil in the back of the tongue. We use it in many end-of-life care patients that have cancer, as well as other disorders where they're taking large amounts of other medications such as opioids and morphine and things like that to try and control their pain. Now, CBD has shown to significantly reduce the amount of opioids necessary in these patients for pain relief. So that is a great way that we use CBD and CBD oils as physicians at end-of-life care to not only reduce the chronic pain medications, but to also keep the mental state of the patient as long as possible. Number two is quitting smoking and other drugs. Patients taking CBD oils have been shown to smoke significantly less amount of cigarettes during the day. The reason for this has not been well understood yet, but further studies will show us a little bit more. And those same effects that I talked about earlier about CBD oils reducing the opioid use is shown time and time again, both in cigarettes and in opiates and other pain medications. The normal dose for CBD oils for reducing your amount of pain or reducing the amount of cigarettes that you are using during the day is about 400 to 800 milligrams a day. And that usually peaks about 3 hours post-ingestion. Number three is epilepsy and cancer disorders. There are no current studies that have been performed and shown without a doubt that CBD oils reduce seizure effects, reduce cancer effects. However, there are multiple first-hand studies, and this is going to be one of the biggest areas of study over the next few years to try and reduce the severity of these diseases. As far as epilepsy goes, CBD oils are already used in severe cases of epilepsy in children and has shown significant benefits. The dosing to reduce seizures in children is usually 200 to 300 milligrams per day. Now, cancer's very different. There has been some proof that CBD targets cancer cells and actually reduces the amount of cancer cells in lung cancer, breast cancer, thyroid cancer, colon cancer, and brain cancer, as well as a few leukemias. But none of this has actually been tested in humans yet. This is mostly testing in rats. But this is definitely going to be something moving forward, possibly helping us with a cure or at least another treatment to add to the multitudes of treatments for cancer. And lastly, sleep and anxiety-related disorders is one of the biggest uses that I've seen lately for people using CBD and CBD compounds. The CBD oils and CBD powders necessary for induction of sleep and reduction of anxiety is actually lower than most of the other things that we just talked about. Doses as little as 25 to 160 milligrams of CBD a day have been shown to produce sedative effects in patients, allowing them to sleep better. It also increases sleep latency, meaning the ability for people to stay asleep longer. CBD has also been shown to reduce social anxieties as well as some mood disorders. One of the other things that I see a lot of bodybuilders use CBD and CBD oils for is for muscle recovery and muscle growth. Now, there are no studies to date showing that CBD and CBD oils or any CBD product in general helps with muscle growth or muscle recovery. What it likely does do is help with sleep and help people get better rest. And when you get better rest, you improve muscle growth and you improve muscle recovery. So that's likely where the idea that CBD or smoking pot before working out, I know some of my colleagues do that, help with muscle growth and recovery. However, it does not directly act on the muscles for growth or recovery. Thank you for watching Medical Mondays. I'm Dr. Alex Spinoso. I appreciate everything. I appreciate all your feedback. Please ask questions. Please comment below. If you have a question, email me, DM me, comment. I look forward to hearing you. I'll see you next week.